Okay, so I'm going to be talking about discharge plan for a patient with acute kidney injury. So before your patient leaves the hospital, you want to go over their discharge plans with them. Most importantly, you want to talk about post-hospital care and things that will have to be done after they leave the hospital setting. One of these things is following up with their primary care provider or their nephrologist, which is a specialist. Just to follow up with an appointment after they leave the hospital setting to make sure everything's going according to their healing plan, everything's okay, and just monitoring them. Also, another important part to this would be to follow up with the dietitian. Dietitian can plan modifications to the patient's diet according to the degree of their kidneys function, and as well to their ongoing needs. So this is very important, especially if that patient does not have a lot of knowledge about nutritional needs, certain foods and stuff. So this would be a great follow-up to have your patient go to would be with a dietitian. Also, you want to advise your patient that there will be frequent medical visits, not only to a PCP, a specialist, or a dietitian, but also for scheduled lab visits. So the labs would include blood work, urine for blood. You would monitor creatinine or BUN. Make sure they're not high. If they're high, that could indicate that there's a complication or something going on with your kidneys. And healing is not going according to plan. So before the patient leaves the healthcare setting, you want to assess for their level of independence. If they have a support system, if they have family that helps them, if they have friends that help them, if they live alone, or if they live in an assisted living. So this is all really important because you want that patient to have a support system, have what they need at home in order to heal properly, have what they need, and most of all, be safe. Safety is important. So you definitely want to let them know, like, if they're not independent, they need assistance, they don't have family members to help them, they don't have any friends to help them, and they're just alone, that there are home care nursing resources, social work assistant resources. Also, if they live with their spouse and they're elderly, that the spouse has resources that they need in order to take care of their spouse. Make sure that the whole family system, the people that live in that home, also have the resources that they have to be able to take care of them and to deal mentally and emotionally with what is going on. If they need help financially, and see if there's other resources to help them with that as well. So this is a really important thing in a discharge plan, is making sure the patient has what they need to recover successfully. So some important key points that you want to mention to your patient during the discharge is they should absolutely monitor their intake and output. How much fluid is going in, how much fluid is coming out. You want to make sure there's a balance. If there's not enough fluids coming out and there's a high output number, then that person could become dehydrated. If they're intaking a lot and not voiding enough, that could cause fluid overload. So this is very important to mention to your patient, to have them monitor, and if there's any issues, to contact their doctor. Also, a balanced diet. This is where the dietitian can come in. A balanced diet is key to make sure they're getting enough protein or potassium, calcium, sodium, less potassium. So balanced diet is key for healing and recovering, especially from acute kidney injury. So this is also something you want to mention to your patient and make sure they're aware of and have knowledge about. Another key point, which basically goes with everything in healing and recovering: smoking cessation. No smoking. If they do smoke, see if they can use alternatives. There's other things that would work for them. Also, no alcohol intake, just because of the acute kidney injury, their kidneys are not working right, they're recovering, so alcohol would just get in the way of that. So it's very important to go over these key points with your patient. So you also want to let your patient know when to call for help, when to call their primary care physician, when to call 911, when to let somebody in the house know what's going on. So any new or worse nausea or vomiting is something that the patient wants to let their primary care physician know, or someone in the house, so that they can call for help. Less or no urine output is very important. It means something could probably be going on with their kidneys or some other complication in the body. So definitely let someone know about that. New or more urine in the blood, also something very important to look out for, monitor for. Any new swelling could lead to fluid overload or some other complication in the body. So that's definitely something that you want to let your primary care physician know as soon as possible. Any rapid weight loss or weight gain, also very, very important, especially when you're monitoring those intake and output. So you also want to let your doctor know about that. And also any nausea or dizziness, you want to make sure that if that patient is home alone, if they have any dizziness or lightheadedness, to call 911, call for help. So that way, safety is key for all patients. So you want to make sure they are safe, they know what to do, and they know who to call for that. Lastly, you want to teach your patient about important things. So one of them would be daily weights. It's important for your patient to have daily weights to monitor fluid overload, and make sure they're not gaining weight, losing weight. So you want to teach your patient daily weights should be taken at the same time every day. Wear similar clothing. So for example, if you tell your patient, okay, let's say you weigh yourself every day at 10:30 in the morning. So every day at 10:30 you would weigh yourself. Use the same scale. It's very important. Make sure the scale is on 0, not more or less. And also, same type of clothing. So one day you don't want to be taking your weight with jeans on and a thick sweater, and the next day using, let's say, like exercise clothing that's a little lighter. You want to make sure you're consistent, because that could have your daily weights affected. You could have more on one day, less, and that could be an issue. Also, monitoring their blood pressure. You want to let the patient know that it's important to monitor their blood pressure. So you want to make sure that that patient knows the range of blood pressure that is normal, and when to call their doctor if it's too high, too low. So that's something important to go over with. Also, you want to see if the patient can take their own blood pressure, if they have an automatic blood pressure cuff at home that they can use, and they know how to work it properly, where to place it on the arm if the cuff size is right, what buttons to press, where to place their arm, not up above their head, not low, so that's very important things to go over with your patient. Also, if they have access, if they don't have one at home, if they have access to like an automatic blood pressure. I know some pharmacies do have them, so if they have access to that. Also, if they have a family member that knows how to take a blood pressure, that could also be great for the patient. That way, they could have somebody else do it. So you want to make sure your patient knows how to do these things well. You want to make sure you teach them, demonstrate to them, let's say like taking a blood pressure, getting an automatic cuff, showing them before they leave. Ask them to teach it back to you, explain it back to you, or have them demonstrate it to you is an important thing to make sure the patient understands.